Hi, good afternoon. We welcome you to the next session. I'm Dr. Yablokhui, and this is my co-chairperson, Dr. Lim Kukai. And this session is very exciting. We're going to be talking about stem cells. We're going to be talking about exosomes and cellular biology in the role of facial rejuvenation and tissue rejuvenation. I'm going to introduce the first speaker, Dr. Michael Pasquale. Pasquale? Pasquale, okay. So it's my honor to introduce Dr. Michael Anthony Pasquale, a board-certified plastic and reconstructive surgeon with over 38 years of experience spanning aesthetic surgery, microsurgery, hand surgery, and regenerative medicine. He trained at top institutions including NYU and completed his fellowship under the renowned Dr. Julia Terzis in reconstructive microsurgery. Dr. Pasquale is a medical director and chief surgeon at Infinity Life Center in Shanghai and Honolulu, and he leads the Athena Clinic International Fellowship in Aesthetic Surgery. He holds patents for surgical tools used in breast and buttock augmentation, and is a sought-after educator, frequently lecturing across Asia and chairing the Korean Stem Cell Symposium. Please join me in welcoming Dr. Michael Pasquale.
Test. Well, aloha, that's hello from Hawaii. My talk today is brief. It's going to be about stem cells, a little bit on peptides, and a little bit on exosomes. And the title of my talk is The New Cosmetic and Reconstructive Frontier, which I really believe, I think we're moving into a whole new era with cellular biology. About 5 years ago, I gave a talk at something called the Pan-Pacific surgical meeting, and I presented stem cells and some cellular medicine there, and I said one statement to people in the audience, all surgeons, and I said, the statement I made was that, 15, 20 years, maybe 30 years from now, we're going to be extinct like the dinosaurs. That means surgeons. Because I truly believe cellular medicine and manipulation of biochemical pathways and so forth will overtake some of the surgical procedures and put a lot of surgeons out of work. In other words, let's take, for example, if you have an amputated finger, it used to take us 8 hours to put it back on, 6 hours, whatever. In the future, I think they'll come up with some substance, peptide, this, whatever, put a couple of drops on the finger and it'll regrow. That, I think, is the future. How long it takes from this point on, I'm not sure. So I'm going to go over what I have the most experience with, which is stem cells. We have started the Hawaii Stem Cell Treatment Center in 2013. So we have a couple thousand cases under our belts at this point. So that's our beautiful Hawaii. That's our banner, Hawaii Stem Cell Treatment Center. So stem cells, I don't know what level of education you have towards stem cells, so I just cover the basics here. Stem cells are undifferentiated cells of a multicellular organism that are capable of giving rise to infinitely more cells of the same type, from which certain other kinds of cells arise by differentiation. If you really get it down to the basics, there's only two types of stem cells, embryonic and adult, and from there we have subdivisions. Embryonic cells are complete generic blanks. They're tuned so broadly that it has unlimited career potential to become any kind of cell of the body, which also means tumor. So we don't like to use embryonic stem cells for anything in clinical medicine. Adult stem cells, they can renew themselves. They have a limited pathways that they can take to become other cells, so they're a lot safer to use. At least that's my belief. What stem cells can do, they can become new cells, new muscle cells, new blood cells, new lung cells, new liver cells, and so on. Stem cells, these are basically repair cells looking for a job. They know how to find areas of injury and can do the repair. They can replicate into more stem cells if they want, and they can turn into other specific cells or tissues as previously mentioned. What causes them to do this are different growth signals, growth factors, and so forth. Injured tissue emits certain chemicals that say I'm injured, and stem cells can recognize that. So the concept, and I don't really see this explained by very many people, but why do stem cells work, injections and so forth? Stem cells are found all over the body, just like you can see here, right? Let's see, is that right? Yeah. So they're all over skin, down here, down there, everywhere. But they're in fixed locations. That means these stem cells don't just get up and move to another part of your body. If you cut your left arm, the stem cells from the right side of the arm don't all of a sudden run over to that side. For example, there's probably anywhere, and it's estimated, no one's sure exactly, but there's up to 1 billion stem cells throughout the body. However, free floating in the blood, there's only 50 million maybe at a time, which is a subtherapeutic amount, which means to really make tissue change and heal something, you need about at least 500,000 cc's or times 10 cc's, 500,000 stem cells times 10 cc. So you need about 1 million or so. So we call it liquid gold. So what happens is when we extract the stem cells, and I use fat, we concentrate those stem cells, which I'm going to go over in a minute, and all these stem cells from wherever we extract an area of fat get concentrated. And it's concentrated stem cells, which you wouldn't find normally in nature, in an area that needs repair. So when we extract the fat, my technicians take the lipoaspirate, which contains a large number of stem cells, adipose-derived stem cells, ADSCs, and they do share a lot of characteristics with bone marrow. I mean, some people use bone marrow. I don't. It's too painful. So each source, when you do extract the fat, it's variable for each production of the solution in the stromal fraction, which is the red solution we create, and I'll show you a picture in a minute, is 10% stem cells when we extract it with an enzyme. If you don't use an enzyme, you get a lot less. Progenitor cells, fibroblasts could represent up to 40% of the SVF. CD34 cells represent large numbers and can compose up to 50%. But we're after the stem cells. So this is a graphic of what the stromal vascular fraction we create from the fat we've extracted. Take a look at that. And so the stromal vascular fraction, the SVF, is a regenerative solution. It does contain healing factors, various ones, which I'm not going to get into. It also has anti-inflammatory components to it, and it's also immunomodulatory. So say someone with osteoarthritis or even rheumatoid, it will modulate that. And so harvesting of about 50 cc's of fat in a liposuction technique, incubated with enzyme, spin and wash it more than 3 times to remove the trace of the enzymes. 50 cc's on an average will yield about 10 cc's of stromal vascular fraction. Now my technicians have really improved their techniques over the years, and we get about 30 cc's with a high concentration of techniques. They vary the temperature and so forth of the incubation. Then we do, and that's the stromal vascular fraction right there, that's what it looks like right here. We do our cell counts, and a lot of places don't. And the reason why we do it is because we do study, of course, we study it, but we really want to know how many stem cells were given a patient. And so we do our stem cell counts on everybody, and then we inject it. Our counter gives total cells, live cells, dead cells, so forth. So before I get into this, let me just say this. So some people use umbilical stem cells. The problem with those, at least in the States, is when we order them, they come frozen. And if you order a certain number, say 20 million or 30 million stem cells, half of them are dead or more than half, so you never get as much as you order. And the only reason we know that is because, back to the stem cell counting, is because we do an actual count, and we can tell. And if you don't do the count, you're not going to know, right? I'll move it along. So what I'm going to present is a series of pictures where we were studying, does the amount of stem cells you give affect the outcome in cosmetic patients, mainly facial use. It's a subcutaneous injection of the stem cells is how we did this. So this is one patient, case 1 I call it. Her stromal vascular fraction contained at least 4.3 million stem cells per 10 cc. And as you can see, 6 months later, her nasolabial folds were less. The melasma was all gone for the most part. Her skin lightening. But also, more importantly, if you look at her, her skin just appears more youthful, bright. And that's from the effect of the, we probably put 15 Cs in her, and it's like, so like 8 million stem cells total or something. 8 million. Case 2, she had 4.6 million, which is greater than, is about the same as the other one. And you can see changes in her face as well. Her skin was whiter, less dark spot, less wrinkles. Case 3, she had 4.3 million stem cells per 10 cc's placed. And her skin's a little lighter, less dark spots, less lines. She just looks a lot brighter.
Dr. Pasquale, I'm going to have to ask you to wind up.
I'll wind up real quick. So this is a good outcome too, 4 million. Hers was terrible. I want to show you that real quick. This gal at the bottom, she had below 2 million stem cells per cc, and you can see that she didn't have any outcome at all compared to the other ladies. One final thing, and I'll let it go at that. We also use stem cells to treat scars. This was a patient who came to me with terrible liposuction, a lot of dents and so forth. I re-liposuctioned her, but she had this really bad burn and dent from liposuction. And then that's her post-op and pre-op picture. This on the left, she finished her tattoo, by the way. But as you can see, just the stem cell injection alone really did a number on the scars.
Thank you very much.
Yes. Thank you very much. If anybody want to get...
Do we have time for a question?